So moved. Okay, thank you. Marie, would you like to provide the health officer's report, please?
Sure. Good evening. So in our department, we conducted 16 food safety inspections, 5 pool inspections, and we had only 2 public health complaints. Quiet around the department. Today, actually, we posted some information directly from the CDC on the coronavirus as requested by our township manager, so that's available for our residents on there. I can forward that to you tomorrow, what was posted on our site. It was directly from the CDC. On February 10th, I think I emailed you all to let you know the Attorney General had arrived at Radnor High School for a press conference to announce his office filing a lawsuit against Jewel Labs. So there's a statement on the website. I think I forwarded that to you as well. The lawsuit was about jeopardizing the health of all Pennsylvanians, especially the young people, and selling them, targeting them, the sales towards them. On the 12th, I attended QPR training for suicide prevention at the Ballackinwood Library in Lower Merion. So that was pretty interesting. On the 11th, and Linda is going to talk more about that, I just wanted to let you know that the township hosted the documentary Kensington in Crisis here in the Radnor Shire Room. I want to remind you all that National Day of Unplugging is officially March 6th to 7th. Radnor Township School District is going to celebrate it on March 2nd due to their school schedule. Basically, they're encouraging parents, students, staff, and the community to unplug and connect. So they're really just trying to let people know that you don't need to unplug for the entire day, even just part of it or short periods of the day, to dedicate powering off your devices. Here in the township, we're gonna promote that on all our social media sites. The township, I don't know exactly what we're doing, but I'm waiting to hear from, our PIO on this, but we're gonna be showing our support. Each department's gonna show their support. They're gonna print out the sign, and we're gonna each department's gonna take the pledge, and there's an official poster that you can download from the site stating your reason why you're unplugging. And then we are going to post it on our social media sites. And finally, just a little note or clarification. I also sent you some information on a discussion about the drinking water in Radnor Township. I just want to remind you or just kind of clarify that this was talked about in the summer, but why it kind of came back up again was one of the commissioners, a resident reached out to one of the commissioners and asked if the Board of Health could take a look at this again and determine if any further information is needed about any potential contaminants in the drinking water. Thank you.
Thank you very much. That was a thorough and very nice report. Thank you, Marie. Really appreciate it.
I have a question. And that was about the concern that they had about EWG, is environmental water. What's the G stand for?
Yeah, Environmental Working Group, I think it is.
Working Group, okay.
Yeah.
And I looked them up, and apparently they did some, scientifically sound research projects on water quality and found that there were contaminants in the water that is not measured normally. And so I saw them as more of a watchdog group as opposed to a combative group, and that probably we should consider just keeping an eye on this and not completely tabling it, because I think they are a pretty resourceful organization that has a lot of valuable information and data to offer us. Because in the letter from the gentleman from Aqua, PA, he kind of poo-pooed them and dismiss them as not really being a valuable resource for valid information regarding water quality. So I'm not sure if what Aqua says is completely, I don't want to say that they're lying, but that there's more to it than meets the eye.
Yeah, thank you very much. We'll look at that. We'll talk about that in a few minutes, but I had some comments on that as well. Okay, some old business, the student intern projects. So any update, comments?
So we're doing our, I guess, close to final revisions, hopefully, for our survey questions. We tried contacting Mr. Bechtold, who's the head of the wellness study, but we have yet to hear back from him. We also contacted Amy Goldman. She's on the school board about the process, but it's still a little unclear. So today, Dr. Kabarsi actually sent out an email to all of them asking what the specific process was. Anything else?
Yeah, we're just looking for approval for our survey and going through the process. And as Leah said, we're pretty much on our final revisions for our questions and just fixing up the wording and the background research.
Yeah, what we're finding is that the biggest barrier to them doing the survey is getting approval. I also asked if there was a difference between doing a professional scientific research project as opposed to a student-based project that probably will not get published, and whether we need to go through this entire process or they could just use the guidance counselor or the principal as somebody who could okay it. So hopefully we'll get that information back, and and that they can progress, because time is now becoming of the essence, and we really need to get this accomplished so you can administer your survey.
And is the survey going to be online or paper ballot?
It will be online, most likely, through like SurveyMonkey or one of those sites.
Good. I've been reading the emails back and forth, and it seems excellent. And I know how much work you're putting forth. I could just tell by the body of the emails and how much research, and that it's terrific. So you're to be commended. This is
Thanks.
really, really super good job. And thank you very much, Jane, and for doing that. Okay, vaping update. So I was just going to provide a little information. I mentioned I would talk about this tonight for a few minutes. So Superintendent Flanagan and I went and presented to the Southeastern Regional Educational Support Professionals, and that was on January 25th at Concord Elementary School on a very rainy morning. There were about 30 or 40 participants, and they were various workers in Delaware County, ranging from food services to library support, that sort of thing. So we did an oversight of vaping and some of the dangers, and it went very well. And thank you, Marie, for talking about Attorney General Shapiro, who visited Radnor High School last week to talk about the lawsuit about the Juul company targeting minors and the dangers. So hopefully we'll hear more about that. I also recently did a presentation last week to some physician groups and did a little more background looking at updating some of the numbers and number of poisonings related to vaping and human exposures to e-cigarettes and liquid nicotine as of January 31st, 2020. So last year it was 3,100 cases were called into the American Association of Poison Control Centers. And last year it was over 5,300. So I'm not surprised with the purchase of illegal substances in our own country and abroad with various nicotine products in it. And so far in 1 month, it looks like it's 360 cases, January into February. So we'll see how that goes. As far as the laws, I think we're all aware of that PA House bill was passed. That was Bill 473. And basically that was signed by Governor Wolf. And that'll raise the age from 18 to 21 years old to purchase any kind of cigarette products in the state of Pennsylvania, which would be good. And that should go into effect probably the spring this upcoming spring, and the hope is that the 18-year-olds will not be buying tobacco products or vaping products and then selling them to the younger kids. So hopefully that'll curb some of it. However, my worry is honestly kids going onto the web and purchasing them in other ways. So that's to be seen. On January 2nd, the FDA banned most fruit flavors and mint-flavored nicotine-containing products. And then just an update on e-cigarette vaping product use associated lung injury, EVALI. That's the coined name for the lung damage caused by vaping. So we know there was an outbreak in August 2019 where there was a rash of e-cigarette related lung injuries. And what we're noticing up until December, January last month is there's been a sharp decrease in the number of cases presenting to healthcare workers related to this, which is good. So we're thinking the media, social media, et cetera, the word got out that, to be careful. So we're still seeing it, but not on the level of that. So what they did find out was there was 82% of hospitalized patients reported using THC-containing products with vitamin E, and vitamin C as a base. And 3/4 of these lung cases, patients reported getting THC from informal sources, so not your regular dispensaries, your medical marijuana dispensaries. So it's, family, friends, and they don't know exactly how it's being made, that sort of thing, illegally. As of January 14th, 2020, there was over 2,600 lung injury cases associated with the use of e-cigarettes, vaping products reported to the CDC in all 50 states. 60 deaths, unfortunately, have been confirmed in the United States related to this lung disease. And 66% of cases are males, median age 24, range 18 to 85. So 94% of all these EVALI cases between the ages of 13 and 17 had THC compound in them. So when they did the biopsies, that sort of thing, and history, they were able to determine it was marijuana-based. And it was purchased informally, like I mentioned. And so that's kind of where we are right now in the state. As a healthcare organization, Mainline Health, we're working on better screening tools for people coming in, so I'm really excited about that. So it'll really look more into the vaping history and getting some educational materials together for inpatient, outpatient. So that's good to know.
Thanks for that information, Linda. I have some questions. Why do they think I'm surprised that vaping poison phone calls or exposure phone calls to poison control were less in 2019 than 2018. What do they attribute that to?
No, sorry, I probably misspoke. So
Okay.
to clarify, it was 3,100 in 2018
Okay.
and 5,300 in 2019.
Oh, it's
So
gone
my
up.
mistake.
Okay.
Mm-hmm.
Okay. So taking the fruit and the mint flavored, the ban for those, what's the point of that? There are other flavors out there. Are those the ones that are most popular amongst the kids? Is that the reason?
Yes, definitely. So yes, like mango, fruit, they're the most popular ones. When I did the talk a while back, definitely.
I think you had
And
mentioned
mint
that,
flavored,
yeah.
yes.
And then the other question I had is, some states have limited sales or sales of certain flavors. I think New York has a total ban on sales. Do you know if any localities have imposed restrictions on sales?
I know Massachusetts was the first state to ban all flavored vaping devices. I am not sure. I'd have to query and see if there's been, I know Philadelphia was looking into that as well.
Okay. Because even though the state of Pennsylvania doesn't ban it, I just, I feel like we should really push for that in Radnor Township, complete ban.
I'm not quite sure how that would work, if you'd have to go before the Board of Commissioners or how that would work. Because I know like 7-Eleven, I actually called them last week, they sell mint flavored, and you can still get mint flavored Juuls and Virginia tobacco in the state of Pennsylvania, but the other flavors of Juul are not sold in Pennsylvania. I think it's mango, like creme brulee, and you can still get that online.
Thank you.
Okay, just to mention future presentations, I'll email something out for March and April. Dr. Haymaker is going to talk about osteoporosis in May, so thank you very much. And then we'll have the student intern presentation in June. So thank you very much. The aqua statement, so Marie touched on this, and Dr. Carabassi talked about it. So I did read through it. So it sounds like if there's a concern by the residents, they're able to call Aqua, and they don't test specifically in Radnor Township. And like you said, Dr. Carabassi, there was some talking in here from, I guess it was Mr. Ertz, who mentioned that residents could call Aqua and get a printout of what was in the water. And it looks like Pennsylvania is well below the any kind of levels, 7 to 12 ppt, whatever that is, compared to 70 being, it should be 70 or below, and we're in the 7 to 12 range, but that sounds like it's probably across the state of Pennsylvania, not specifically in Philadelphia.
He also said that our water is not, it's gotten from somewhere out here and not in Philadelphia, so that might make a
Pickering
difference.
West Treatment
Yeah,
Plant?
Pickering, that's right,
Right.
which is out in Chester County, I believe. And, but, you know, it just would be interesting to find out where they get their data from, how they go about evaluating the water, and compare the two between the watchdog group and them. And, you know, it might be a concern to Aqua that there is an organization out there that is trying to create checks and balances on them. So, but I don't know, because obviously I'm not an expert in water quality, but I would be concerned that there might be more to this than meets the eye.
I think what's tough is that federal regulation, you know, they say, well, we're complying with federal regulation, but at the same time, the EPA hasn't said what a safe level is. So it's kind of, you know, so I think, you know, information overall just needs to be obtained about these contaminants and the significance of them.
I know this was a concern voiced by a resident last summer, correct? And went to the commissioners, but the commissioners thought it should be vetted through the Board of Health. I'm not sure how to move forward or best to vet this.
I think they might be looking for some sort of formal recommendation as to whether or not this requires, you know, further debate or further discussion, despite what Aqua had put out last summer.
I guess I'm just curious, like, where the sampling's taking place. So is it out of our township spigot or just some big repository of water up in Pickering? I don't know if we get the water from there. I have no
to
idea.
go back and check my notes.
Yeah, I have no idea.
I think it was the latter, what you said. They're not testing in this direct area, but it comes out of that plant. And I think that's where a lot of the levels are coming from. But I'd have to double check that again. It's been a while since I reached out to him. And I can actually reach back out to him if you like.
This gentleman from Aqua?
Yes. He seemed, unless somebody else wants to take that on, I mean, whatever works for me. He seemed to be very willing to have a conversation. He said at any point in time, even if one of the commissioners wanted to have a conversation with him, he would be happy to have that.
So I know I'm kind of late to the party. So I guess what's the request? You just want the information? You want to know about testing? Has there been an issue of people felt that their water is contaminated in some way? Is there, I guess, I don't know what has prompted the inquiry and what result we're trying to get to. If it was because one commissioner heard from one resident who maybe read a study and was curious, I don't know how much time we want to spend on it, and, there's nothing to move on as the Board of Commissioners. So if there's, some outcry from the community because water tastes funny now, I guess I'd love a little history about why we're looking into it, and, how can I help get the information that we need.
Yeah, do you want me to give her a little update? Sure, I'm happy to. Okay, which, I can do the best I can. So there was an article in the Patch written back in the summer, I have the date, I think it was June or July, and it listed, this activist group, EWG, had listed the results of these carcinogens in our township water. So residents got a hold of it, there were some questions that had come up. The township reached out to Aqua, who put out a statement. And I have that here. Okay, so that kind of, the residents were happy with that statement, I think, at the time. Some time had passed, and just about 2 weeks ago, I think it was Commissioner Booker had received an email kind of referencing that article way back when, and some newer concerns about the drinking water in the township. I don't think anything was found. I think it was just something that the residents read, and wanted. So I think it was Bill White or somebody had let them know that Aqua took a statement out a while ago, but Commissioner Booker wanted the Board of Health to revisit it or to visit it, because you guys weren't involved initially, right? So they wanted the Board of Health to review everything and decide if any further, discussions or conditions should be discussed. Does that make sense?
Yeah, it does, but it doesn't seem like this is the Board of Water Quality review. So, how deep do we want to go into this, I guess is what I'm wondering. If it's because there was a study and now there's been a statement, it's either accepted or not. And if there's some reason to believe that Aqua is not providing accurate information, then I think there's something to move on. Otherwise, this seems to be, if you're gonna, it seems just to be a response to a resident who was curious, and it was like asked and answered. So I guess I'm not quite sure what the, what we're seeking to do here. I'm happy to bring anything to the board, but I guess I need to know what that would look like.
Well, I think the concern is that we don't know what the level of safety of PFAS in the water is. Like, that's not well known. So I think that's the concern is, well, if the, what, I forget what level they said is safe, that they're low and way under the health advisory. And I think this group is bringing up, should they be lower? That's my understanding of the issue. Should these levels be lower than they are? Well, I'm not sure we as the Board of Health are able to say if they should be lower. I think it's more of an environmental concern, and it may be correct. Maybe they should be lower, but I'm not sure that we're going to be able to determine at the Board of Health if they should be lower or not. Seems like it's a regulatory overall issue.
I don't want to complicate things, but it seems to me it depends on where they're measuring the water. If it's one thing to measure the quality of the water in a reservoir someplace, and quite another to measure it by the time it gets through 200-year-old pipes. And is there anything we can do to? Yeah.
Well, maybe that's something you could bring up with the gentleman from Aqua again is, where do they get their water sources to measure? And what kind of standard do they use?
If there's some basin around, there must be something here in the township, or is it piped in? I have no idea how it gets here. Ray, would you be willing to ask him? So I guess to determine like what sampling method and where they're getting the sample from, is it like some kind of a big holding tank area out in Pickering Water Treatment Area? I don't know how it's done scientifically. And then is there, if it's transported down here, would that be a avenue for stuff getting into the water? And
Is it done after the treatment of the water at a treatment facility? And I guess, where do they get their sample from is the big question.
Do you think we need to have him come in and talk about it?
Good idea.
Yeah. Okay, see if he would come down and give us, 5 or 10 minutes. I think it's worth, and then we could post it on the website. Any neighbors, residents that are concerned can certainly come to the meeting. Okay, thank you. Okay. What was I? Oh, I didn't put on here the Kensington project. So Marie mentioned the Kensington crisis. It was here on Tuesday, February 11th at 7 o'clock. It was excellent. We had about 130 people present and a couple of members of the board here. I learned a lot about the individuals of Kensington. It was an hour film on the plight of Kensington and the residents and extreme challenges of addiction that the residents encounter every day and those living there. Really good panel. They really talked about the needs of the community and what's going on. Lisa Ertz was here, Zach Ertz's mother, who was a panelist. And she's instrumental in the building of future athletic center in Kensington for the neighborhood children to go as a respite or after school. And also David, I'll probably say his name wrong, Usikian. He was a former drummer of the Hooters who created the music for the film, was here as well. He spoke a few words about the plight in Kensington. And then afterwards, it was a panel discussion of people that lived in the neighborhood and a couple of the activists, question and answer session, which was excellent. And then an opportunity for township residents to learn how to administer Narcan if they were interested. So overall, I thought it was really good. They also gave some information about opioid crisis and worsen in homeless in Philly. So housing is a huge issue in Kensington. And then some handouts on the Poor People's Economic Human Rights Campaign was talked about and distributed. And they also had Treatment Centers of America was on the panel as well.
I thought it was an excellent film, and the panelists were, I think, were even more amazing. The only concern I had, and I did express that to Linda, was that as a community, Radnor Township community, for the most of us, we are very distant from Kensington. And I would have liked to have seen how we as a community could be more involved with this issue, and if there were more people that would be interested in what would be the avenues for volunteering, et cetera.
I completely agree. Maybe we could have one of them come back to a Board of Health meeting and talk about ways that we can, from our community, assist them, because I did feel like it was dire need, and it is distant from us, so to speak. So I echo those comments. I'll have to read the one woman. I gave her my card. What was her name? She was sitting. She has a house right there. Yeah.
Oh.
Yes. Roxanne, was that her name? So would you want to maybe have somebody come back and talk about how we can help, maybe throughout the year? But it was very, very good. Okay, so I need somebody to take meeting minutes, so I'll do that through email, so we don't have to discuss it here and put anybody on the spot. All right, anybody want to say anything? We're done our agenda. early? Any public participation? Okay, so the next Board of Health meeting is on Monday, March 16th at 5:30. It'll be here, and I will not be here. Dr. Simmons will be presiding. So if we don't have any more comment, meeting adjourned.